alternatives. These can be mildly improved with good care and physical therapy and severely deteriorating with ignorance. According to American Anatomy, it can be classified into hemiplegia, diaplegia, quadriplegia, monoplegia, triaplegia, and pentaplegia, where the head and neck control is lost. According to the area affected in the brain, it can be classified into spastic type, which represents 73.4%. Other types like athetoid type, ataxic type, mixed type, resist type, tumor type, and atonic type. Up till now, there is no proper treatment for such severe complicated type, except some psychotherapy, brain stimulants, anti-epileptic drugs in cases suffering from fits. That's all. Also, some corrective surgery can be done, but just for cosmetic reasons, but no proper improvement occurs. For those hopeless and helpless children, I start to think and search how can I help them. I start thinking about the wonderful stem cell. I start reading and searching. I found that the stem cells have the property of turning into new healthy cells of the affected tissue. In this case, we are talking particularly about the damaged brain tissue. Also, the stem cell therapy for cerebral palsy contributes to the reconstruction of the new blood vessels and the improvement of blood flow to the brain's affected tissue. What are stem cells? These are cells, as we said, can be differentiated into different types of cells, for example, blood cells, nerve cells, white blood cells, liver tissue, and heart tissue. By this way, 80 plus of treatable disease can be used. We can use stem cell in its treatment, like autism, liver cirrhosis, Parkinsonism, cerebral palsy, so many things we can add. The pathway of stem cell in the body, it can be after injection, it can take two ways. Either it replicates and duplicates very frequently, or go to the affected area, stuck to it, it changes to the same type of the tissue of the affected. And this is the stem cell. Here is migrate to the organ, spine, heart, lung, brain, differentiate to other two different types of the tissue, leading to finally functional improvement of the organ. Here it can be also go to the thymus gland, lung, spleen, lymph nodes, the peritoneal cavity, bone marrow, skin, liver, etc. That's why I was thinking so much for so many things. I did it later on. This is the brain mice. You can see an area of defect with the white arrow. After injection of stem cells, it was completely healed and resolved. Under written consent from the parents that they had been consumed all methods of treatment under all specialties, and they had no hope for the treatment of their children, and they are agree what I'm going to do for them. I have been chosen 10 children with different types of severe cerebral palsy, 5 males and 5 females. Age was group was between 5 and 13 years old. At first, I inject them with the stem cell intrathecally. The first improvement was obtained in the oropharyngeal muscles just a few weeks after injection. So the child can swallow better, can eat better, can grow. This is the first thing I got in my children after injection of a stem cell. Also, chest crepitations from aspiration pneumonia decreased or disappeared. Drawing of saliva was completely stopped or markedly decreased. The child can eat and swallow even solid food for the first time in his life, like chicken or beef or whatever it is. This encouraged me to add other groups of patients, younger and the elder, and other groups of injection. The end result was more than expected. Some of the children start to walk unsupported, and the others can walk with the help of scan or elbow crutches. The trial was done on almost 900 patients. The improvement was obtained in 60 to 65% of them. This improvement varies between 50 and 80%. This 60 to 65 improvement, including that the boys who did not come again for the second injection, who came only once to my clinic. This schedule shows the experimental stage in vitro and in animal group and in volunteers, and then phase 2 on human eminence. It was safety and efficacy, it was all completed, as we see here in this schedule. This is the first one. He has flaccidity upper half and rigidity lower half. He was crawling on his face in this brownish area you can notice in the knee and elbow, and he has also adduction of the lower half. Sorry, the upper half is flaccid, the lower half is rigid. He has adduction deformity of the hip, flexion deformity of the knee, talibus equinovarus, both ankle joints. He was operated 3, 4, 5 times before me, and the 6th one operating. This is intraoperative. I correct the adduction and flexion and the talibus equinovarus. I inject with the stem cell, and I put him in a hip spica. After 1.5 months, you can notice the difference even in the face of the boy. You can see here the face, and you can see it after 1.5 months. You can see a child, normal child, raising upper limbs. After 3 months, he can sit and flex his knee, and now he can flex and extend both knees independently. This is another case. She cannot sit even without support of one of her relatives. By the red arrow, you can see in my clinic, she can, after 3 months, she can raise both lower limbs, and she is walking in my clinic, going here and there. Again, as a toy type, the child is completely flamed, doing nothing. He is not talking, he is not walking, he can't do nothing at all. This is the face, you can see a mentally retarded one. After 1.5 months, he is trying to sit, and he is trying to take his first step. After 3.5 months, he is standing, talking, calling me out here. I'm talking and walking. He is raising both upper and lower limbs independently, and he is entering my clinic by the hand of his mother. This is the difference between the shape of the face in the beginning and after 3.5 months. Again, this is another girl. She has spinal bifida occulta as well as cerebral palsy, and she has multiple trophic ulcer. The red arrow points to one of it. After injection, I didn't inject the trophic ulcers. I just inject intrathecally. It completely disappeared, and the skin is healthy and smooth after 1.5 months. This is the difference between her shape before and after. She is talking, she is standing, talking, walking, clapping, and singing also. And you can notice the difference in the shape. This one, this is flare type, and then after that, after 3 months, she is entering my clinic, walking by the hand of her parents. At least she can help herself. First, she was carried by her parents. Also, this patient, but unfortunately, I have no pictures because his father was refusing me to take pictures for her before. After injection, 1 month, she is still in POP. She can raise hands, she can sit independently, raising hands, and she can go down of the bed and walking in the clinic, going here and there. This is a boy, Syrian one. He was operated 3 times, 2 in Canada and 1 in Germany. And the professor, Dr. Adel gave me this boy, and he told me, just do it. After doing it, I will consider this research. I did it. He met him walking after 3 months, praying, Goma prayer, but unfortunately he left the ministry after that. He can raise both lower limbs in the POP, he can flex it, he can extend both lower limbs, it is corrected. Future of the stem cell therapy, we can think about it. We were talking about yesterday and the day before, we were talking about spine injury, head and neck injury, sport injury, neck injury, tendinitis, knee ligaments injury, tendinitis and wrist injury, ligamentous tear. I'm using this, now I'm using the stem cell in treatment of these injuries, and this is giving excellent results with me. Again, after I succeed to do this one, I try some difficult method. This boy, he's a case of myopathy defined by from Dr. Amr Khalil. Here, this is called myopathy. And then the CPK was before was 6,649. After 3 months, it comes down to 87, and you can see the child who was completely